Thank you. Now, joining me in the studios is our consultant public health physician, Dr. Leah Roberts. Once again, welcome.
Thank you very much for having me, Ladi.
Now, let me begin from where Kayla stopped, which is the issue of the testing. For the first time since this started, yesterday, Lagos reported no new case.
Well, I would take that
under advisement. Okay, but at least the NCDC did not report.
Yes, it's probable that by the time the NCDC was making the reports, the results hadn't been uploaded
to the site. Okay.
So what we'll probably find is that there's yesterday's and today's being reported.
Now, this issue of community testing and the community spread is now front and center.
Absolutely.
Everybody now seems to appreciate what it involves.
Absolutely.
Is that helpful going forward?
Absolutely helpful going forward. The truth of the matter is we really do have to get an idea of the scope and spread of COVID-19 amongst in the community, because we definitely do have community transmission. And unless we have an idea of what we're dealing with, we won't even be able to put in place strategies and interventions to contain it. So we do have to have, and what we have is an expansion of testing, of sample collection, because the testing is still done in specialized laboratories. So, but we have a lot more places that are now collecting the samples, and we have a lot more volunteers coming forward saying, oh, please test me, and that is going to be helpful in the long run. Truth of the matter is this is the kind of disease, if you look for it, you will find it.
No, but is there not the fear of being swamped? If all those who have one reason or the other to present themselves come out, would the health personnel not find?
Well, we've ramped up our capacity quite a bit, but there will be that fear of being swamped. You can see that in the UK, it's still a problem. In Ghana also, it is still a problem. I believe Dr. Ganiu said we should do side-by-side comparison with countries close to us. But yes, it is a problem, and we will be swamped, and we will still have that situation where we are collecting samples and results are not coming out for quite a while,
because, again, the centers.
Again, the centers, you know, I mean, the kind of testing that is done, the process of the test is, you know, limited by time and materials. At the end of the day, the game changer is going to be a rapid test whose results we can rely on.
Which hasn't yet presented itself, because we had a medical lab scientist here yesterday, yes, and he still said, well, look...
We haven't got anything. He's very right. We haven't got anything as yet that's been accredited by the NCDC or the WHO, and it's going to be from the medical laboratory lab scientists. But there are tests that are available. I'm looking at the one that they're using at the White House, for example. I mean, if somebody's kind enough to donate that to us here, we will be very...
Now, the Lagos State governor did say yesterday that they intend to prosecute now those who are telling, who are giving wrong information or false medical history to healthcare personnel because of the potential it has both for harming the medical personnel and then, of course,
backfiring on the person itself. However, I will take that on advice, because I now heard the story of the gentleman who eventually then died in Louth. And judging from the story, I can see very easily how information got lost in the process. The truth of the matter is that if we don't have solid electronic medical records, which tracks every bit of information the person gives every single healthcare personnel he comes across. He says something to one doctor. He's not likely to remember to say it again or again.
In the exact same way.
In the exact same way. And he will assume that if the doctors are communicating, that information should be passed on. So if the first doctor that saw him had put everything into an electronic medical record, which the second doctor was able to just open and look at, then no information gets lost in translation. So for me, it just sort of underscores the need for us to digitize, you know, health information properly and to have it available at the point of care. So yes, the governor is well within his right to prosecute, but it's suddenly making me think that people are probably not deliberately misinforming. You know, it's just that in the panic and the stress of the moment, things do get dropped.
Now, people like you are now in the front line, and there aren't that many of you.
No, not anymore.
Definitely, this crisis, this health crisis, will require for us to keep all those who are available.
Absolutely.
Because in other places, they're even inviting those who have retired to return.
To return.
And come and help out. Which brings up the issue of welfare.
Yes.
Has the situation improved?
No.
Because we are expecting more people to come forward for testing. We're expecting to see a lot more patients. We're expecting more visits to the isolation centers and so on.
In fact, I've just had the very heartbreaking news that a young lady had to go home because she hasn't tested positive, despite the fact that she's definitely symptomatic. And suddenly, there's no holding space for her. So, you know, we are anticipating these problems. And the issue is that, you know, with the ramped-up testing and sample collection and everything, we are going to get a jump in numbers. That's for sure. The good thing, and I must say it over and over and over again, is that we're simply not seeing that descent to severity that is being seen in Europe and the US. So yes, people are going to probably test positive. I mean, if we tested them and they turned up positive, the essence is we now have to develop new strategies for sheltering at home and making sure they can look after themselves at home and not necessarily take walking well, you know, into the isolation centers.
Do you think we should continue to build more and more of these facilities?
When you say build a facility, I'm not talking about the brick and mortar. It's everything that goes into the health system that needs to be strengthened and gaps need to be plugged. We do need to have the personnel. The personnel do need to have the equipment. And, you know, the personnel aren't just the doctors and the nurses. We have to have the medical lab scientists. We must have the pharmacists. We must have the physiotherapists. Then don't forget, we need the biomedical engineers. I mean, all the equipment we're using has to be maintained. Then we need the specialized cleaners. We need the ambulance drivers. We need the paramedics. So it's an entire system of people that need to be put in place. So really, our health system is as strong as the people that work the health system. Because as was shown by the isolation center in Oniko, it only takes 4, 5, 6 days to put up a structure. But the structure in and of itself, without the people, does nothing.
Going forward, we've got a few days left of the current lockdown. What do you want to see?
Certainly a reversal of the lockdown, because the pain of the lockdown has now far exceeded the benefits that we can get out of it. And for most people, the majority of whom live beneath the poverty line, the scare of COVID is nothing compared to the real scare of hunger and starvation and insecurity. I mean, I've got certain workmates of mine who live in a certain area that shall not be named, who are every night doing vigilante to keep their area safe, because there are a lot of women and children, and most of the men on that community were caught outside the community by the lockdown. And so the few that are now, they are literally standing guard.
Dr. Roberts, thank you so much for being with us. It's been a pleasure.
It's been an absolute pleasure.